Hey guys, this is Dr. Rich here at the Tinton Falls location. Here I'm with patient Enrica, and today we're going to go over different types of traction for the cervical spine. We're going to go over manual traction, the Y strap, and then we're also going to go over mechanical traction, the spinal decompression machine. So when we're dealing with traction works great with a bunch of different patients. Typically whenever you have someone with a disc condition, joint inflammation, cervical sprain strain, or muscle spasm, as part of our evaluation, we'll just traction a neck, okay? Even like anyone who has a pinched nerve. And usually a patient will say, wow, that feels good, I don't feel any pain. If that's the case, this is what we're promoting in the office. So this right here is just basic manual traction with me as the provider. I'm just applying some nice pressure, pulling her neck, and I'm going at each different vertebrae, applying a little stretch. You can do that anywhere from 8 to 10 seconds. As the patient progresses, you can hold it for longer, or you can give her a much more intensive stretch. This will really help whatever condition that she's suffering from. Worst case scenario, she just might be a little sore, which she can definitely manage at home with ice or stim or heat, rubbing some biofreeze in the area. So this is the Y strap, okay? Whenever we have a patient who needs a little extra pull, we progress them to the Y strap. So right now I'm pulling on Enrica. That feels good, Enrica, right?
Yeah.
Okay, same concept. You can hold it anywhere from 8 to 10 seconds. You can increase it more to the 15-20 second range. The patient feels good with it. With the Y strap, depending on the patient too, you can stretch and you can just add a little impulse to it just to provide an adjustment. Some of our patients really like it. It's such a good intensive stretch that they might even feel it in their upper back, upper middle thoracic spine a little bit too, just release. And again, we're doing traction, so this is lengthening the spine so it feels good as a general stretch, and it's great for posture as well. So now we have cervical decompression. This is a form of mechanical traction. Again, this is another progression. Whenever we have a patient with the conditions that I talked about prior, this is just a more intensive stretch, especially if we have like a pinched nerve, cervical disc herniation, cervical bulge, anything like that. It'll pull mechanically for 8 to 10, like before, 8 to 10 seconds and relax, and it'll do that anywhere from 8 to 10 minutes. It's a way to flush out more of that inflammation, okay? Now, the same side effects, the patient might be a little sore, which they can manage with heat, ice, or stim, and there's a progression to this. There's different levels at which you can pull, and you can pull it for longer durations. In general, traction is a very, very useful treatment modality to use in office. Of course, with anything else, you have to watch out for contraindications. So any patient who has an underlying fracture, severe instability of the spine, we typically don't do it, but that's something in our exam when we're pulling on a patient's neck. If it hurts, then most likely we're not doing traction. And most of our patients prior to doing any of these services, they usually have like an X-ray, MRI, just to rule out certain of those conditions that would be a contraindication. All right, so that's it for the video today. I want to thank Enrica for being our participant, and I want to thank everybody for watching. If anyone has any questions about this sort of technique, feel free to ask questions, ask your provider at the office, but this is something we can definitely utilize if it's something that would benefit you.